Welcome to today's webinar, the role of diet in cognition. And your presenter today is Dr. Heather Francis, and I'm your facilitator, Nicola Graham. We start all our programs with an acknowledgement, so we'd like to acknowledge and pay respect to the traditional custodians, past and present, on whose lands we meet today. And we acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and respect the cultural authority of the elders in each community. So it's with great pleasure today that I introduce you to our presenter, Dr. Heather Francis. So just some information about Heather. Heather completed a combined PhD Masters of Clinical Neuropsychology at Macquarie University in 2013. She's held positions as a clinical neuropsychologist in the neurology department at Liverpool Hospital and as a postdoc researcher at the University of New South Wales and Macquarie University. Currently, she's a lecturer in clinical neuropsychology at Macquarie University, and she holds a position as a senior clinical neuropsychologist in the Royal North Shore Hospital Neurology Department. In terms of research, Heather's primary research interest is in the area of nutritional neuroscience. Her studies have examined the effect of Western-style diets, the high saturated fat, refined sugar, processed foods type diets on cognition and mood, and she's also looked at the therapeutic potential of a healthy Mediterranean style diet on improving symptoms of depressed mood. And Heather has an additional interest in the assessment and remediation of cognition and social function in neurological conditions such as multiple sclerosis and brain injury. And current projects include the role of inflammation in cognitive fatigue in people with multiple sclerosis, and the efficacy of a group memory training program in people with multiple sclerosis, which sounds like some really good themes, Heather, for some further webinars. But let's have a look at this one first. Okay. So this is a research update. The information presented today is based on research findings, and it doesn't include management strategies. We have got some other webinars that will provide some management strategies for you. And if you need further, more individual advice, please contact MS Connect on 1800 042 138. Okay, so what I'd like to do now is just hand over. Heather's in Sydney. I'm here in Melbourne, so I'm just going to change so that you can see Heather's screen, and Heather's got her webcam on so she can say hello to you as well, so that's great. So thanks, Heather, over to you. And that's wonderful, we can see your...
Oh, good. Well, hi everyone, and thank you, Nicola, for that very lovely introduction. I guess I just wanted to really echo what Nicola has said, which is that I am coming at this webinar from a research perspective. So I'm not a dietitian, and my focus in terms of clinically and in terms of my research is really the role of diet on cognition and the brain. So it's a bit different to focusing on physical health symptoms. And I'm not providing information necessarily on management of symptoms, but a lot of the information that I provide, I think, really is very much in line with the Eat Well, Live Well webinar that's available on the web. Some great behavioural strategies as well. Okay. So hopefully this works. So I obviously won't be focusing for very long on the on cognition in multiple sclerosis, but it's important, I think, for the rest of the webinar to understand what the effects of multiple sclerosis on cognition can be. So MS is typically known as affecting physical function, The impact on cognition, I think in the past was less well known and not as recognised, but now it certainly is. And it occurs in, depending what research you look at, around 58% of people with MS will experience some difficulties with cognition, but that's not everyone. Not everyone will have cognitive difficulties. For many people, if they do, it will be very mild, and then the pattern and the severity can vary. The processes that tend to be most affected are speed of thinking, so how quickly you can process information, and also not so much basic attention, but usually complex and sustained attention. So attention when you're doing multiple things at one time, or when there are a lot of distractions, or sustained attention being able to focus for long periods. And those two things, how quickly you can process information and whether you can pay attention, tend to then have secondary effects on your memory. So if you can't pay attention when someone's telling you something, or someone is talking too quickly, you're less likely to be able to remember it. The processes that tend to be least affected are things like general knowledge, long-term memories, and language skills. And similarly, I'm not really going to focus on the causes and the pathology underlying MS too much, but because it's very relevant to the effects of diet on the brain that I'm going to talk about, I wanted to briefly touch on the role of inflammation in MS. So MS is an autoimmune disorder where the body's own immune cells attack the central nervous system, so that's the spinal cord, the optic nerve, and the brain, and can cause inflammation, neurodegeneration, and damage to the myelin sheath, which is known as demyelination. So the myelin sheath is a fatty layer that surrounds the long axon of all neurons, or I'll call them brain cells. And the myelin sheath helps to speed up the messages that are sent between brain cells, and also to protect them from damage. So it's sort of like cushioning all around the outside of it. So inflammation can damage that myelin sheath, and that then can slow down the messages sent between brain cells, and the brain cells can get damaged. And if they become very damaged, they can die. All right, so moving on to diet. Why am I going to talk about how diet can affect cognition today? Well, it's partly because when I see people with MS clinically, they'll often ask me if there's anything they can do apart from the pharmacological treatment that's been prescribed by their neurologist. And I think it really helps people to have a bit of self-efficacy over their own treatment and disease. So there are quite a few studies that show that people with MS tend to seek out alternative ways to boost their wellness, and a lot of people turn to diet, whether that's changing what they eat, so their actual diet, or whether it's taking supplements like omega-3s, or taking, additional spices, antioxidants, that sort of thing. And the reasons that are cited include general health, reducing muscle weakness, but also one of the main ones is alleviating memory problems. So at least anecdotally, there's research to show that people will change their diet because they think that it does improve their memory. So I'd like to talk about the evidence to support that. And in general, I would say overall, there is evidence to support changing your diet, improving it as much as possible. And so I guess the idea of today really is to give you some information that helps to motivate you in making those changes, which aren't always so easy. So how can diet change the brain? Well, in a number of ways. Firstly, proper blood supply to the brain is necessary to deliver oxygen, glucose, and other macro and micronutrients for proper cognitive function. And nutrition has a role in maintaining optimal blood supply to the brain. Another way is through neurotransmitter synthesis. So a neurotransmitter is a chemical that's released from brain cells to send messages to other brain cells. And proper diet's important for making sure your brain gets all the ingredients it needs to produce those neurotransmitters. So you need a variety of amino acids, iron, B vitamins, vitamin C, D, zinc, choline, all of which you get from your diet. And then I've already talked a little bit about inflammation, particularly in MS, and diet can certainly, poor diet, so eating a lot of processed foods can increase inflammation. And then there are a lot of foods that will reduce inflammation, and I'll talk about those. And similarly, there are foods that can increase oxidative stress, and they tend to be more processed foods. And there are foods that will reduce oxidative stress. So oxidative stress is something I'll come back to a few times throughout the talk, so I'll briefly describe it. But basically, when your cells produce energy, they also produce some waste, which are known as reactive oxygen species. And these reactive oxygen species float around the cell reacting with things, and therefore creating damage. Your body has some capability of removing those reactive oxygen species, but there are antioxidants that are available through different foods, things like vitamin E or blueberries or fish oil, that are beneficial to the brain because they counteract those reactive oxygen species. They are antioxidant. So that's what it means when you hear about the term antioxidants. So my research didn't start off in MS, but started off really looking at the effects of diet on the brain. And my PhD started looking in animals. And I had two groups of rats, one that was given a high saturated fat and refined sugar diet, and one that was given their normal healthy rat pellets. And we found that after 12 weeks on that diet, the rats with the high saturated fat and refined sugar diet had impaired memory on memory tests. And they actually, when we looked at their brains, had changes in the hippocampus. So they had neuroinflammation, they had oxidative stress, and they had changes in a number of proteins that are actually involved in Alzheimer's disease. So then I went on to look a bit more in humans to see if this effect can also be obtained in humans, and found that even in healthy young adults who are of a normal body weight, if they habitually consume a high fat and refined sugar diet, they tend to have poorer memory function. And then looking from a causal perspective, we showed that even just 4 unhealthy breakfasts, to be fair, they were very bad unhealthy breakfasts, but just 4 of those breakfasts caused a decline in memory function compared to a group that were eating normal healthy breakfasts. And those memory changes were associated with changes in blood sugar levels and also inflammatory markers. So there's very good evidence now that eating a healthy diet reduces your risk of depression and cognitive decline, especially in aging, but there's good research now coming out in younger populations as well. And on the flip side, that eating an unhealthy diet increases your risk of depression, it increases your risk of cognitive difficulties as you age, and increases your risk of Alzheimer's disease. So how does it do it? Well, it's partly that you need a healthy diet to provide all the nutrients that your brain thrives on, but it's also because an unhealthy diet increases inflammation. And given the role of inflammation in multiple sclerosis, I think it's worth then talking about what the research is about diet and inflammation in MS and how that can affect cognition. Now, a lot of you have probably heard about either the Swank diet or Swank's research. And this was a study in 1952 where he observed that there was a decreased incidence of MS in coastal towns where they had high fish intake, and an increased risk of MS in cities where animal fat consumption is high. And so this has led to quite a movement toward recommending that people avoid saturated animal fats in particular if they're diagnosed with MS. And I also wanted to talk about another study. This one was done in Iran, and it looked at the incidence of MS from 1989 to 2006. And so back in 1989, there was less processed food intake. And then as over the course of those decades intervening, Iran became a bit more westernized. There were increased access to takeaway foods. I won't mention specific fast food outlets, but I think you can probably guess what they are. And at the same time, there was an increased incidence of MS. Now, there are observations like this that suggest that there is a role of the environment and particularly diet in MS, but they are simply observational studies, but nevertheless, there's so many of them now that the evidence sort of all together accumulates to be quite strong. So overall, there are a lot of epidemiological studies now. So these are looking at an association that show that a lower risk of MS is associated with higher intake of omega-3 and omega-6 polyunsaturated fatty acids, with a high intake of fiber and a high intake of whole grains. And that there's a higher risk of MS associated with high consumption of saturated animal fats, with sugars, and with high alcohol intake. So again, this is an example of an epidemiological study. So again, it's just association, but it's a large number of people. It's quite nice because it's conducted by a group in South Australia. So that of the 2,087 people in the study, 550 were Australian. And they showed that those people who had a higher dietary health score on a questionnaire that asked questions about diet had better physical quality of life, better mental quality of life, and lower disability. So on the screen there, you can see that on the side, you can see that what's being shown in those bars is the mental health composite. So those were a number of questions about both mood, but also cognition, so how their thinking is, how their memory and attention skills are. And those that had a higher fruit and vegetable subscore, so they were eating more fruit and vegetables, had a better mental health composite. And those who were eating more healthy fats also had a better mental quality of life composite score. So what was the diet pattern in this particular study? Well, so for the healthy fruit and vegetable group, so the one, if you go back to this slide, the one that's got that highest bar, the highest mental health composite, they were eating 5 serves of vegetables, 2 fruit servings, legumes, and raw nuts or seeds. And then the healthy fat group had frequent consumption of fish, avocado, monounsaturated oils like olive oil, and minimal consumption of oil in cooking, so frying foods, minimal processed or fatty meats, minimal cakes, biscuits and sweets, and takeaway foods. Now you might notice that a lot of what I just described is quite consistent with the Mediterranean diet. The Mediterranean diet is probably the most well-known and most researched diets. It's low in saturated fat and added sugars. It's high in antioxidants because of all the fruit and vegetable intake. It's high in omega-3s, particularly from the fish intake. High in protein from lean meats, and has lots of protein, vitamins and minerals. And the benefits for health, longevity, and reduced risk of cardiovascular disease are very well known. I'd like to tell you a little bit about what's known in terms of effects on cognition. So in both healthy and younger adults, randomized controlled trials have shown improvement in cognition, like attention and memory. They've shown slower rate of cognitive decline with age, and reduced risk of dementia, for example, Alzheimer's disease. One of a very recent study conducted in 2017 called the SMILES trial actually put people on a Mediterranean diet for 12 weeks, or they had two groups, one that was put on a Mediterranean diet for 12 weeks compared to another control condition. And they showed that those on the Mediterranean diet had reduced levels of clinical depression. So this is really convincing evidence that a Mediterranean diet can improve brain function in general, and in particular depression symptoms. In terms of cognition, there's been some studies that have shown that switching to a Mediterranean style diet even for 10 days can improve both mood and cardiovascular function and aspects of cognition like memory recall. And in general, a higher adherence to a Mediterranean diet is associated with a reduced risk of MS. So I want to introduce here the idea that fat is not so bad. And I know in a way this goes against the ideas that are, it doesn't necessarily go against the Swank diet. So I think what's really important is type of fat. So, and it depends, I think, on when you were potentially brought up, but people, for example, I think in the 70s and 80s were told fat is bad in general. We're now coming to understand that fat is not so bad, and it really depends on the type of fat and where you get it from. It's not so much the case of, you know, for example, avocados and eggs have high cholesterol and therefore they're going to increase your cholesterol levels. We now know that if you're eating good fat from natural sources like avocados, and from, you know, getting fat not from processed foods, like either processed meats like salami, but also through, so for example, sunflower seed oil. Yes, it does have high omega-6 polyunsaturated fatty acids, but it's also highly processed. So in order to extract the oil from a tiny sunflower seed, it has to go through this high heat extraction process. So it's a hydrogenated oil. And that's very different to, for example, with olive oil, where to get the oil out of an olive, it's simply pressed. So that's what cold pressed means. So in general, if you can have sources of fat that are as close to their natural form as possible, so, you know, fresh fatty fish like salmon and tuna, nuts, you know, particularly if you're having a nut butter, having it without the added sugar and salt that's often in them. And if you're selecting oils, try to get cold pressed oils. This slide sort of speaks to the same point. So we know that omega-3 and omega-6 polyunsaturated fatty acids are a very important aspect of our diet. They help form this sort of this membrane that surrounds every single neuron, every single brain cell. So where do you get them? Well, you can get omega-3 polyunsaturated fatty acids from fish, especially oily fish like salmon, from flax seeds and chia seeds, and from walnuts. And omega-6 from seeds like pumpkin and sunflower, so that you don't need to be purchasing expensive nuts. For example, you know, pumpkin and sunflower seeds are quite cheap as far as nuts go. And, you know, for example, if I'm having cereal for breakfast, I'll sprinkle some pumpkin and sunflower seeds on them, or you can get like an almond linseed, what is it, LSA, almond, sunflower and linseed ground up mix if you don't like the texture of nuts. So sprinkling these things into salads and onto breakfasts and things can really help to up your omega-3 and omega-6 intake. And what that does is it can reduce inflammation, reduce demyelination, and improve myelin sheath repair. And actually, omega-3 and omega-6 polyunsaturated fatty acids are decreased in the plasma and CSF of people with MS. So that's something that really would be ideal to boost. So what's some evidence that omega-3s, for example, might be causally involved in cognition in MS? Well, there are some trials, and by trials I mean where you've got two groups, one which are given the omega-3 supplements and another group that is not. And overall, there are several clinical trials that have shown reduced disease progression for the omega-3 group, decreased presence of inflammatory cytokines in blood samples, and improved physical and mental quality of life. In one in particular, so some are open label, which means that people know what they're getting. And so in those you might have a placebo effect, but there's at least one, a randomized double blind, so both the people in the groups and also the people assessing them, study had a significant improvement in their reported quality of life. And that was after 6 months of both supplementation, but also being put on a low saturated fat diet. So I will say that not all trials have found a significant effect. And one factor that does seem to affect whether there will be improvement observed is whether other dietary recommendations are given to the participants. So I think the takeaway message from that is that, you know, if you're eating terribly every day, if you're having takeaway multiple times a day, or you're having a lot of sugar intake, particularly through, for example, soft drinks, popping an omega-3 pill's probably actually not going to have much of effect on your disease progression. Whereas if you generally improve your diet, then omega-3 supplementation might assist. This is another randomized controlled trial that I found really interesting. They found, so in this trial, groups of people with MS were given a supplement that was a combination of polyunsaturated, monounsaturated, and saturated fatty acids, together with vitamin E, A, and gamma tocopherol. And what they found was that supplementation actually reduced the annual relapse rate. So it didn't reduce it to 0. People still had relapses, but they had fewer relapses. It reduced the time to disability progression, so it slowed the rate of progression, and it reduced the amount of new or enlarging lesions on MRI, which I think these are really convincing findings. What's particularly good about it is that it was over 2 years. There are not many studies that have looked at duration that long. Most are only for 6 months, largely because it's very expensive to run an RCT, but often you only get these effects after being on a supplementation or diet for quite a long time. But I guess the takeaway message I wanted to have from this study is not necessarily to go and seek out this specific combination of supplements, but more just that there is evidence that over the long term that having, you know, seeking out these particular nutrients in your diet can be really beneficial for, you know, for your brain, and that you're not going to find 100% reduction in disability, for example, you still will have relapses, and so it can be really hard to maintain motivation to stay on a particular, if a diet's really restrictive, it can be very hard to maintain your motivation to stay healthy if you are still having relapses, if you are, your disability is progressing. But I think the evidence here shows that it's very likely that the relapse rate will be less and that the time to progress of disability will be longer. So I want to cognition, but nevertheless, I thought I'd comment on it just because I always get asked. But I guess what I wanted to say is that they can be quite restrictive. They don't always have adequate consumption of some very necessary nutrients like vitamin A, C, or folate. I think they potentially actually have been updated a bit, at least on the website, to avoid hydrogenated vegetable oils. I'd avoid anything that's a highly processed oil. And that the studies that demonstrated sort of efficacy of these low-fat diets didn't have a control group. So it's not showing specifically causality. And I think it's certainly, over that duration, particularly from 1952, those who were eating a high saturated fat diet were eating things like, burgers that had a really high fat content, chips that were fried in fat. And so yes, they did have high saturated fat content, but also they were highly processed. So I don't necessarily discourage going on these diets, but I also think you need to find a diet that's a lifestyle change that you can do over a really long period. So if you're finding it really restrictive, loosen the restrictions a little. And the main thing to try and do is avoid processed foods. So I also wanted to talk about polyphenols and the brain. So polyphenols are naturally occurring chemicals that are found in foods, and they're found in things like fruit, vegetables, red wine, green tea. So a lot of your really dark leafy green vegetables, and then your richly coloured berries, that sort of thing. And there are a number of studies that have shown improvement in cognition with intake of different types of polyphenols. So resveratrol is one that's, I think, probably maybe the most famous one because it's found in red wine, but it's also found in dark berries, the grape skin, for example. And that's been shown to reduce oxidative stress, to reduce neurodegeneration, and it increases blood flow to the prefrontal cortex during cognitive tasks. And then another source of polyphenols that I think has gained a bit of, hello? So another source of polyphenols that's gained a bit of traction, I think, in the media is becoming a bit well known is the yellow spice turmeric, or which has curcumin, which can reduce, it's anti-inflammatory and antioxidant, and it can reduce the inflammation caused by Western diet. I guess I'd give it a bit of a caution that I wouldn't go for your turmeric lattes. They tend to also be very high in sugar unless you're making it yourself. But I tend to add turmeric to when I'm cooking curries. If I'm making a salad, I'll make a salad dressing with some lemon, olive oil, a tiny bit of honey, and some turmeric, which is quite delicious. And you can create a yummy peanut chicken skewer by mixing natural peanut butter with some turmeric and soy sauce. So you can add it into a lot of foods. I won't talk too much about vitamin D because I actually think it's probably something that everyone's already gotten a lot of information about, but except to say that the further someone lives away from the equator, the higher the risk of MS, and it's thought to be because of the reduced sun exposure. And maintaining adequate levels of vitamin D might have a protective effect and lower the risk of developing S. So the risk of MS has been shown to be substantially less for women taking greater than 400 international units of vitamin D per day. So I think getting your vitamin D tested is a really, helpful thing to do, and considering supplementation if your vitamin D levels are lower. But it's also something to flag, so you can get vitamin D from sunlight, even just going for a short 15-minute walk with, say, your arms exposed, particularly if it's in winter. But you can also get vitamin D from your diet, so through things like mushrooms. Something to consider in the winter months. I'm going to talk only really briefly about fasting. And partly I wanted to talk about it because there is a lot of upcoming research about it. So I get asked questions about it, but I do think it's a new research area. I wouldn't necessarily suggest that you go ahead and start fasting, but I wanted to tell you what the latest research is on it. So not in MS, just in general, periods of fasting have been shown to increase brain cell activity, to increase the strength of connections between brain cells, so how they fire together. It promotes the growth of new brain cells, which is known as neurogenesis. It can induce repair of brain cells and reduce inflammation, both of those last 2 points being really important in MS, and it can improve cognitive function. And what do I mean by fasting? Well, it can be as little as going 16 hours without food. And the reason it's thought to be beneficial is so your body needs energy to survive, and it can get it in 2 different ways. When you eat, energy is sent to your liver and it's stored as a form of glucose called glycogen. However, if you don't eat for 10 to 12 hours, that depletes those energy stores in your liver. And instead, what happens, your body has to mobilize fat from your fat cells. And those are converted into compounds called ketones. So you might have heard of the ketogenic diet. And the ketogenic diet is promoting you mobilizing that fat from your fat cells as a source of energy. And research has been showing that your brain benefits from using those ketones as a source of energy instead of glycogen. Why that's the case, I'm not sure that we particularly know yet, but nevertheless, that does seem to be why. And the reason I wanted to bring it up is because there's some really promising research you may have heard of being conducted by so the sort of head professor heading up this study is Professor Walter Longo. I hope I'm not butchering that name. And basically this research started out in animals, and in these animals they gave them a fasting mimicking diet. So this diet's low in protein, low in essential amino acids, and low in sugar, but relatively high in fat. So it's sort of mimicking the effects of fasting. And they got mice with experimental autoimmune encephalitis. So that's not, mice don't get MS, but this is sort of an animal model of MS where they have similar pathology. And they see whether they can remediate that pathology. And what they found was, oh, hello? I thought I might have heard Nicola. That's okay. All right. So what they found was that they had 2 groups. One group who received a fasting mimicking diet for 3 days out of 1 week, over 3 weeks, and then another group that just consumed a standard diet. And they showed that the animals on the fasting mimicking diet had a significant reduction in disease severity scores. They took spinal cord sections of the experimental autoimmune encephalitis mice at day 14, and those in the fasting mimicking diet group had significantly reduced immune cell infiltration and demyelination. So they had less disease burden in the brain just after 3 weeks on this fasting mimicking diet. So then this same group performed a study in humans. So 60 patients with relapsing remitting MS were randomized to either getting a fasting mimicking diet for 7 days, followed by a Mediterranean diet for 6 months. Then one group got a ketogenic diet for 6 months, and one group got a normal diet. They just stayed on their normal diet for 6 months. And so the fasting mimicking diet in this study was at least 9 to 10% protein, 34 to 47% carbohydrates from plant-based sources, and 44 to 56% from fats, but no animal fats. And the amount of calories in total was around 700 to 800 calories per day. So it's quite low, but they did that for 7 days, and then they had a Mediterranean diet for 6 months. And what they showed, if you look down the bottom at those graphs, they showed that both the fasting mimicking diet and also the ketogenic diet to a certain degree, though not as significantly. So the fasting mimicking diet is the one in white. And you can see that their quality of life overall was much better than the normal diet group. So the normal diet group's in black. The health-related quality of life score was higher than the normal diet for both the fasting mimicking diet and the ketogenic diet group. And then the third graph there, letter M, showed that their physical quality of life was significantly better in the fasting mimicking diet group. And the quality of life mental health score was significantly higher in the fasting mimicking diet group. So what I think is really quite interesting about this study, it does show that the fasting mimicking diet for 7 days, so only 700 to 800 calories per day, was tolerable for that particular group. But this design isn't able to tease out whether it was the fasting mimicking diet or the Mediterranean diet that caused that improvement. I'd be quite curious to know whether that fasting mimicking period is even necessary or whether you could just do Mediterranean diet for the 6 months. Nevertheless, it's quite convincing evidence that improving your diet can improve many different symptoms of MS, including your mental and cognitive quality of life.
Heather, can I just interrupt with a couple of questions, please?
Absolutely.
Okay, so a couple of people have referred back to a few slides ago with the Patricos 2014 study with the supplement, the nutraceutical that was given. And just questioned because it had saturated fat component in it, that they were a bit confused about that, thinking that they should be reducing saturated fat, but that study was supplemented with saturated fat. So if you could just give a bit of clarity around that, please.
Yes, of course. So they had a minor quantity of specific saturated fatty acids, and I will say that all of the literature on saturated fatty acids and the association with MS risk has been observational research. So, for example, that Swank research. But we do actually need saturated fatty acids in our diet. They provide, for example, medium chain and short chain fatty acids that are building blocks for both brain cells and other cells in our body. So I can't comment on the specific saturated fatty acids used in that particular study. But I guess in general, I would just say that, you know, I think reducing the overall amount of saturated fats that you get from particularly from processed foods is certainly a good recommendation, but I don't know that the evidence is there to say that you need to be really, really restrictive in your saturated fat intake. Again, I'm coming at this from a research perspective, and my research is focused on the effects of diet on the brain. So I'm not a dietitian, so I'll put that caveat on everything I say, but that's my sort of clinical opinion. Yeah.
Okay, great. Thanks, Heather. Thanks for that. That's all the questions we've had at the moment.
Okay, sure. So I guess this point also probably speaks to that question. So there are a number of specific diets. There's the Overcoming MS diet, there's the Wiles protocol, the MS recovery diet, there's a whole lot more as well. And I've not actually commented necessarily on the literature around these, because what I've really tried to focus on is the effects of diet on cognition in MS. So if there have been studies that have been done that have looked at these specific diets but haven't included cognition or effects on the brain, then I've not reviewed that. That's a very vast literature, in fact. But what I will say is that in general, what most of these diets do seem to say is to increase your fruit and veg intake, to increase your fish intake, particularly fatty fish like salmon, and to increase your whole grain intake, and then to avoid things like processed foods, fried foods. A lot of them also say to reduce your dairy intake, and the evidence is there yet, and that's really a very personal thing. You know, if you do find that not having any dairy in your diet and making sure you seek calcium from other sources does make you in general feel better, then absolutely pursue it. But I don't know that the research literature is there enough to suggest that you must be really restrictive regarding that. And so then I guess the overall take-home message that I really wanted to emphasize is that diet doesn't have to replace medical treatments. I think it's a really useful adjunct. And that the overall takeaway message that I think comes out of the literature on both diet and the brain, but also the more general literature on diet and MS risk, is to eat lots of fish, fruits, vegetables, nuts and seeds and whole grains, and to avoid processed foods. So really just try to eat foods in their whole form. And, you know, a lot of different diets have different variations on that, but if you look at the commonalities in the successful diets, I think that these are some really sensible recommendations, and also B, that I hope this sort of literature and the research findings can help motivate you, because the literature shows that they don't stop the disease. They don't even necessarily stop it from progressing, but they might slow the progression. They might slow any cognitive deficits from emerging. And you don't get that if from an individual perspective. You know, if you're on one of these diets, it can be really hard to stay motivated to stay on it, because, you know, you still do get disease progression, but you just don't, the literature seems to suggest that it would be worse if you don't stick with them. There's obviously good evidence to make sure you get enough vitamin D via sunlight, as well as from fish and from, it's meant to say dairy, not from diary. And again, that's a very personalized thing as to whether you want to have dairy in your diet. And I would say there's not enough evidence yet for fasting mimicking diets and ketogenic diets, but certainly something of interest. Obviously, if you're going to do any of those, particularly if you suffer from fatigue, I think it's really necessary to talk to a medical professional or to a dietitian who specialises in MS. And again, I really want to emphasize, so no single food or supplement is likely to fix everything. Even in the RCTs where they showed a benefit of supplementation, there tends to be better effects when there's also diet recommendations given. So really just focus on your whole diet. And it doesn't have to be really restrictive, even if you're just making some small improvements, like reducing the amount of sugar you have in your coffee, reducing any, replacing soft drinks for a cup of tea, that sort of thing. Any improvement that you can do is likely to reduce the amount of inflammation that you're getting. So that's all that I had to get through. Were there any other questions, Nicola, that have come through? Or I'm not quite sure what the last question that Nicola posed actually was, because I didn't catch the second half, but I think it was something about fasting. And I certainly do think that particularly when you're undergoing a particular treatment, it's important to make sure that you are getting all the vitamins, nutrients, minerals that you need. So rather than thinking about fasting, I think maybe think about making sure that you're getting really wholesome sources of food. So fresh fish, lots of fruit and vegetables, adding as much nuts and seeds in, whole grains, and then really, again, just avoiding processed foods, avoid, cakes and burgers and fries. All of those things are a source of inflammation. So what you're doing by doing that is really assisting, the disease-modifying treatments that you're often given are designed partly to reduce inflammation. And so if you're eating processed foods, if you're drinking soft drinks or eating a lot of fried foods, you're increasing the inflammation and almost counteracting what those disease modifying treatments are trying to do. So it's always an adjunct, it doesn't replace medical treatments.